Hello everybody. So today I'm here to share a few clinical aspects on the chest pain and what type of chest pain the patient may be undergoing in case if a patient is being diagnosed with any cardiology problem. So this unit you can see in the major subjects such as adult health nursing 1, and which is not only a domain of only for AHN, but also you can skim and scan through the patient who is undergoing chest pain. So how we can rule it and what are the do's and don'ts when a patient is having chest pain. So yes, of course, in case of a chest pain, you can see that the patient is having pain radiating either on the chest itself and as well as surrounding structures. So here the pain may be initially radiating on the chest and from that may radiate to the neck as well as to the jaw and to the left shoulders, and some patients may also have the radiating pain to the back, that is the scapula, as well as right shoulders. But how do we differentiate that the patient is having exactly cardiology pain or any else? Might be in case of a differential diagnosis, the patient can have pain around the, like for example, in case of a musculoskeletal pain, if a patient is having a blunt trauma, but without the effect of the myocardial tissues, the patient can again have pain. And as well in some of the epigastric pain such as gastritis, that also may mimic as cardiology pain, or you call it as the anginal pain. So coming to the mnemonic of what is PQRST of pain. The other two is also being added, that is O as well as U. So this OPQRSTU will be having its own, taking its own words, such as O stands for the onset of pain, P stands for provoking or palliating factors of pain, Q stands for quality of pain, R stands for the region and radiation of pain, S stands for the severity of pain, T stands for time and treatment that is being done in case of pain, and U stands for the understanding and impact on pain. So now coming in elaborate of what is O. Onset of pain. When does it begin? How long it was the duration? Or quite often when it occurs, might be in the morning time, early morning, might be in the morning 3 to 4 a.m. or in mid noon, might be in 12 or 1 a.m. or 1 p.m. or in the evenings or in the late nights. Provoking factor. Provoking factor is nothing but what brings on or what is increasing the pain, or what is, whether it is making it any better or whether it is making it worse. For example, patient is having pain after doing an activity. Might be he went for a walk and after the walk he is having severe pain around the chest. Or might be he is going for his routine schedule, that is having his jogging activity or swimming or might be an yoga. So whether it is being relieved or it is still increasing or worsening the pain. So that history we have to collect in case of collecting a chest pain uh, symptom from a cardiology clinic. As well, we have to know what is the quality of pain, how feel, or what is the feeling of that pain, whether they are having throbbing sort of pain or stabbing pain or dull pain. Then what are the other things we may ask is that where is the region of pain, that is what is the site, whether it is radiating. So does the point of pain intensity is moving from the exact point to distant point, as well as where does the pain get relieved. And S stands for the severity. So you're going to ask, show the pain scale comprising from 0 to 10, where 0 is no pain, 1 to 3 is low, or you call it as mild pain, and 4 to 6, which stands for moderate pain. Anything above 6, that is 7, 8 and up to 10 is the worst possible pain. So with that we are going to ask what is the type of pain they are having, and is there any symptoms that is along associated with pain, like for example nauseated, or they are feeling lightheadedness, or they are feeling any dyspnea, that is breathing difficulty, or diaphoresis, that is excessive sweating. All these symptoms, whether it is accompanied along with pain, you will be asking in collecting about the quality of pain, or you call it as the intensity or severity of pain. Then comes the time, that is when it does begin and whether it was relieved by certain medications. Like for example, if a patient is a cardiology patient, he or she may be receiving a nitroglycerin tablet, which is the vasodilator, which is usually placed under the tongue, which is sublingually. So whether the patient had any sublingual tablets and whether that type of treatment has been effective or it had any side effects. So that you will be asking about the time and treatment of pain. And U stands for the understanding and impact, which shows that how they believe or whether they know that the exact causative factor for pain and whether it interfering with the daily activities of living for themselves or within the family, or whether they had any other concerns relevant to pain must be closely monitored. So this is how you assess a patient with chest pain. So that's all for today. If you have any doubts or suggestions on the type of pain, feel free to ask your doubts in the comment box. And don't forget to subscribe, as well as you can share the link to your friends to understand PQRST, or you call it as OPQRSTU on chest pain for patient with cardiology symptoms. Thank you all. See you in the next topic.